A misdiagnosis or delayed diagnosis itself is not evidence of negligence. Skillful doctors can and do make diagnostic errors even while using reasonable care. The key is determining whether the doctor acted competently, which involves an evaluation of what the doctor did and did not do in arriving at the diagnosis. This means looking at the differential diagnosis method the doctor used in making treatment determinations. Personal injury and medical practice attorney John Misgondi says if the doctor fails to run the right tests, a heart attack patient can be sent home only to suffer a heart attack days or months later.
Heart disease is something that can be diagnosed. We have all sorts of sophisticated tests. If the doctors listen and get the clues, so many times heart attacks and heart disease can be prevented. One of the most common cases we see, either in a doctor's office, in an emergency room, or even in the hospital itself, is a patient who's complaining about chest pain and the proper tests aren't done to determine whether that chest pain is coming from blocked arteries, indigestion, or something of that sort. We have so many avenues available now to treat blockages in the heart if it's just caught in time for the doctor to listen and to go down the correct pathway in figuring out what the cause of that chest pain is. If you don't make the proper diagnosis, if you don't do the proper test, then the patient can go on to have a heart attack that leads to death or leads to severe disability. The person may survive.
Now, more than 500 senior doctors in Kenya's biggest referral hospital have boycotted work, demanding the reinstatement of their colleague who was suspended for performing brain surgery on the wrong patient. 3 other staff, the ward nurse, theater receiving nurse, and anesthetist were also suspended. The hospital has denied reports the patient has since died. Are they right to make this demand? Dr. Emmanuel Utomi speaks to us via phone.
I think what the doctors might be alluding to might be that the consultant, the brain surgeon who was supposed to carry out that surgery, is not responsible for tagging patients. You know, in a medical hospital, there are different duties. The person who prepares the patient and the person who, everybody has their different duties. Maybe the consultant might have been invited to come and do the surgery, and his own is okay, you people are, this is the patient and this is the procedure, but be that as it may, every doctor, before carrying out a procedure, must ensure that you confirm that the patient you are about to work on needs that procedure. You must go through the patient's case file. So, honestly speaking, I don't think the doctors have a case at all. They are wrong in trying to go on strike because of that, because the consultant should still have gone through the patient's folder or file to be sure that this patient I'm going to carry out this procedure on is the actual person that needs the procedure.
In a medical malpractice case based on diagnostic error, the patient must prove that a doctor in a similar specialty under similar circumstances would not have misdiagnosed the patient's illness or condition. In the rare case that a doctor diagnoses a patient with a condition or illness that the patient does not have, the patient may also be able to prove harm in the form of anxiety, stress, medical problems, and expenses due to necessary treatment. If you believe that you have sustained losses due to the negligence of a medical professional, you should seek the advice of a medical malpractice attorney. Medical malpractice claims are notoriously complex, and the doctor or other healthcare professional will have a team of experienced defense attorneys on their side. A medical malpractice attorney will help guide you through your case and ensure that your rights are protected. Gimalo-Angel Olowogoke reporting for Level Plus News.